drugs mafia within the healthcare sector in Uganda. Drug mafia are operating freely within the healthcare sector in Uganda. A few days ago, I watched a documentary produced by an investigative journalist, 𝙁𝙊𝙇𝙊𝙒, about government medicines being sold in the black market. Medicines that are donated free to the people of Uganda easily find its way into the black market. It was really disturbing when you watch the documentary of Solomon and you see how these guys are selling medicine that is carrying the label "not for sale." It breaks your heart. I keep asking myself the same question again and again. This medicine had been donated with a label on it, "not for sale." But here, you have our brothers and sisters who are selling those medicine. And then you ask yourself, what has gone wrong with our health sector? I used to think that the medical profession is a respectful profession, that the doctors and the nurses and the people who work in the healthcare sector understand the difference between life and death. But if you watch the documentary by Solomon, then you'll understand that the entire system within our society is broken down. It's broken down. Here we have people who are supposed to save life are the same people who steal those medicines and take it to their own drugstores or pharmacy, wherever they are, while children, women, old people are dying because they don't have malaria medicine, while people are dying because when you go to the hospital, they tell you that there is no vaccine. You have to go and buy it from the drugstore or the pharmacy, which belong to these people. Those journalists did a tremendous job. They managed to start in Kampala, and I see the owner of the pharmacy talking to them and promising them they will get whatever they want. And they managed to buy medicines from those thugs. But they didn't end there. What is surprising is that they went to Arua and they managed to come into a contact with a lady who was sitting there talking freely. Yeah, we have to sell it. If you give us money, I will get it. You can just look at her and you said, here is somebody who has no respect for life. You just sit there, you are not ashamed of yourself. You just say, bring me the money, I'll get you the medicine. She just took her phone, called the contact person in Arua, and the contact person just delivered the medicine to those journalists who were pretending to be dealers. They delivered the medicine, and that medicine is delivered using the government motorcycle. You see how big the network is? You see how complicated the network is? Because they all work together with one another. They all sacrifice to keep their network going. Watching the video is hurting and heartbreaking. You see, some of those medicines that are donated to Uganda are carrying labels which are very clear. Very clear label, not for sale. But you find that the medical staff, administrators, doctors, and drugstores owners, and pharmacy are all involved in the racket of drug deals in Uganda. You see, the journalist investigation didn't stop in Kampala and Arua. They bought some of those drugs as evidence. It tells you how it's very easy to get your hand on those medicine if you want. They bought some of the drugs openly. You just show them the money or tell them you have the money, they will deliver the medicine. That is when you realize that everything in Uganda, everything in the health sector, healthcare sector, is on sale. The system is rotten from top to bottom. Top to bottom. You hear stories that as soon as the medicine arrives in the public hospital and Uganda private clinic, within days they will be stolen and those medicine will disappear from the hospital. It will disappear. And the medicine finds their way either to the drugstore in town or the pharmacy. And then one has to ask himself, who are the owner of those pharmacies? Who are the owner of those drugstores? What criteria do we have that determine who can open a pharmacy who can open a drugstore. That is something that is not very clear, and the authorities in Uganda are not making it even clear. Those brave journalists did manage to reach my hometown, Gulu. And that is the most hurting part of their story. Because this man who was selling them the medicine is from Gulu. I think he has a drugstore in Gulu. Or his brother has a pharmacy in Gulu. Our people have suffered so many years in camp where there was no medicine, there was not enough food, and it's really heartbreaking to see this young man turns into a drugs mafia in Uganda. And he's not ashamed of himself. He said openly that he will sell those things because he has to pay school fees. That is something that I find very stupid, because who doesn't pay school fees? We all have to pay school fees, wherever we are. But we don't have to go and sell donated drugs that are given to help our people. You should be ashamed of yourself. Now those journalists manage to get some drugs from the same man. And he was telling them, said, don't worry about the police. I'll handle that. And if you look at the way he was saying it, then you can understand me now that the network is even bigger than what you think. Because if he can say, I'll handle the police, it means he has got a network. But he showed it also to the journalists, because the journalists wanted more drugs. And he said, okay, if you want more drugs, I have to contact somebody very special, very important in Kitgum. And this person is going to deliver the medicine you want as far as you have money. And they managed to meet this man. Yeah, you can look at him and say, yeah, he's a well-to-do man. He has smart clothes on, good body. And I just look at them, I said, this is making me sick. This is making me sick. These people bought the medicine. I saw them driving to the village. Those medicines were being packed into the car from a grass thatch house. So it means they keep their medicine also sometimes with stolen medicines from the hospital out of a place where you can easily find. So they have to take you deep into the villages to collect it. And these people went and collected it. You see, stealing of donated drugs to help our people is the most low thing I've ever seen in my life. It tells you what society we have. It tells you what we are up to. This is just a small part of the drug mafia's activities. It is immersive. The whole thing is deeper than what what Solomon discovered. There are so many people behind it, because I understand that some of the medicines are even coming out from the military hospital in Wangoo. And if it is true, what I heard Solomon say, that the man was picked up by men in uniform, military uniform. Let's pray he's in a safe place, or he's back home to pay school fees for the children he was talking about. And you know, the problem with our doctors today and our nurses today, the problem is bigger than what we think it should be. A few days ago, I also read that 3 Bugiri hospital staff were arrested, including the doctor. 3 Bugiri hospital staff, including a doctor, was arrested for stealing surgical operating bed. Surgical operating bed. How can you, a doctor or a staff working in the hospital, even think of stealing operating bed that is used for saving people's life? This is how low we have gone. And all the medicines that are being sent to the hospital are stolen. And then I ask myself, if the medicines are being stolen, what is the National Drug Authority doing to stop those malpractices? To me, they're not doing enough. To me, the National Drug Authority only comes out when something leaks out or in investigative reports comes out. Then they move. Then they move very fast. In fact, the man in charge of the National Drug Authority should be sacked, and he should step down. And all those people who are sitting on the board of directors should step down, because they have failed the people of Uganda miserably. They've failed the people of Uganda miserably. Everybody has become a thief. Everybody is turned into a thief. Everybody is stealing whatever they can steal. And those drugs mafia, their slogan is simple: I don't care. See you in hell. That is their slogan. Because children are dying, women are dying, old people are dying, and you are here stealing government drugs, stealing drugs that are donated free to harm the people of Uganda, and you use it for your own personal needs. We all know that public hospital is hit hard by shortage of essential medicines and supplies needed for emergency care. The hospital and government clinics had been struggling, and we had been blaming the government. And we are still blaming the government. Because they have not done enough so far. Hospital like Mulago Hospital, which handles serious cases, sometimes is forced to refer patients to other hospitals, to other government hospitals, because they had been experiencing serious shortage of basic medicine for emergency care, such as vaccine and other drugs. Mothers and babies are at risk of death if something is not done to change the horrible situation in hand. We remember hospitals keeps on referring patients to other hospitals. There are cases where a woman was referred to another hospital, In that process, the woman lost her baby. We do believe that healthcare sector is underfunded, and we pay more attention to military build-up than health care for our own citizens. We pay more attention to building oil pipes than a mother losing a child at birth. We fly around in private jets and travel in motorcade with dozens of cars, while in rural areas, hospital roofs leaks, windows panes are missing, and many equipments are out of function. Believe me. The country only radiotherapy machine broke down and took a year before they got replacement. The poor cancer patients had to suffer because of our poor vision about healthcare. Our poor vision about healthcare. But the blame does not lie only on the government. It is our attitude. The attitude of our new generation, where a doctor, a nurse, a medical staff, who are supposed to understand that they are there in the business of saving life, not taking life. But now, some of them are in the business of taking life by stealing drugs from the hospital, by stealing operating bed from the hospital. It's very shameful. It's very shameful. Recently, I also heard that the National Drug Authority has closed more than 283 drug stores selling drugs in Western region. In an operation to force compliance to Lance's requirement of drug sales in Uganda. The operation took place at Mbarara, Kanungu, Sena, Nutungamu, Rukungiri, Kiruhura, Kasese, Busenyi, Mitona, Isingiro, Ibanda, Rubanda district. They impounded 362 boxes of assorted medicine valued at about 126.7 million Ugandan shillings. Government medicine that could have saved a lot of life in various hospitals and clinics being sold and is in a private hand. Some of the closed drugstores lacked qualified personnel, and many were found in possession of government drugs in Barara and Kihuhura. Nurses operate drug shops, while herbalists and children running lances and unlicensed drug shops. It is not surprising at all, with the level of corruption that had been going on in Uganda. Anything can happen. With medicine, it's a double disaster for the people and the entire population. An entire population. People can end up buying wrong medicine, and the risk to their life could be enormous. In other places, they found a herbalist who is running a clinic, storing blood in syringes, and had a faulty microscope. To be honest, the herbalist in Uganda municipality should be sent to jail for playing with people's life. So if the National Drug Authority can perform operation in Western Uganda, and then you have to ask yourself, what took them so long before doing operation everywhere in Uganda? Ugandans had been complaining about poor services, lack of medicine in government hospitals, clinics. The operation in 14 districts by the National Drug Authority should have taken place a long time ago. I still believe that in other parts of Uganda, a lot of government medicines are being sold in black market, while our people, our children, our women are dying due to lack of medicine. To me, those greedy Ugandans should be arrested, locked up, and the key to their jail room thrown away forever. Because the drugs mafia and the people supporting them have turned themselves into bedbugs that feed on human blood. You are stealing medicine, selling it on the black market. But let me remind you, the blood of those people dying in Uganda because you denied them those free donated medicines, their blood is in your hand. Whether you live or die, no matter where you are, I don't think your children will live happily. Because when you're a thief and you steal, your children will also become a thief. Believe me. If your children are used to enjoy free ride, there will come a time they will have no free ride. So to you, the drugs mafia, you can still stop and give away that lifestyle and stop stealing medicine that can save life. Thank you for listening.